Hello everyone once again. Sorry, I couldn't continue on that other line because the battery of that phone was very low. I should have charged it before coming up live. So like I said once again, apologies for that. And we have a lot of people watching on the other one, about 500 people before I took down that phone line. My name is Dr. Alalade here. I'm one of the admins at AsktheGynaecologist. I know that so many people were asking questions before I closed the other discussion. So I'll try and log in here on my laptop so that I can get questions and I can start taking questions now. So just hold on for me there. Let me bring up this laptop so I can start taking questions quickly as soon as possible, okay? Thank you once again and welcome once again to this show. My name is Dr. Alalade Babajide, one of your admins here at AsktheGynaecologist, and I'm so happy to be here. My joy is to see men, women, homes, families happy to produce and have children according to their desire, when and if they want to. That is my only joy and that is my purpose here, and by God's grace, without doubt, it will be fulfilled without delay by the grace of God in your life, in your home. So welcome back here. I want to quickly bring up I got that live discussion. So I'll bring that up so that I can start taking questions now. As I know, we have many people asking questions, and people are asking questions straight from their heart, questions that are really touching them, bothering them. So I'm hoping my audio is good. Once you have people here, I'll start talking. So people are asking questions. Doctor, please, what causes headache during menstrual cycle? Some people are known to have headaches during that period. Sometimes we call it catamenial headache. People are having headache during that period, having headache during their menstrual cycle. Some people do suffer from migraines even during their menstrual cycle, and we call it catamenial headache. Okay, it's very uncomfortable. It can be so bad. One of the ways to deal with these things is to give medications for headache. Number 2, we can give medications to treat migraine. Okay. Number 3, we can give contraceptive medications to basically reduce the frequency of your period and reduce the pain during your period. We can put Mirena Accord to help and to decrease that as well. We can also consider cognitive behavioral therapy to help with such headaches during period. So these are all the ways we can try that. Okay. Can someone see fertile mucus before ovulation time or still ovulate? Yes, you can see your fertile mucus before ovulation and you can still ovulate, okay? But I want to warn you, for you to ovulate, it is not necessary to see fertile mucus. For you to ovulate, it's not necessary to see mucus. Seeing mucus is not a condition to ovulate. I've seen many women get pregnant and they didn't even see anything that called mucus. I've seen many women see mucus and they don't get pregnant. So for you to see mucus is not the absolute most important thing to get pregnant. Okay, so please, if anybody has told you before that you must see mucus to get ovulation, that person is a talking trash. Is a what? That person is a talking trash. Blessing Omuanakwe. ATG Laboratories is in Lagos, and the advert will be put up now by Nikelayade, one of our ATG members here. She's my secretary. She's working and she's the manager of the laboratory, and she'll put up the link to the laboratory now so that you can get access and link to call her tomorrow morning and get your investigations booked. Doctor, is it possible so Bishola Lizzie say, is it possible to ovulate during period? Very unlikely. Please, what are the chances? This is for Chimele Omodu. What are the chances for someone who has lost a fallopian tube following ectopic pregnancy still having healthy pregnancy? Yes. Even if you've lost a tube, if you have a ectopic pregnancy in a tube, we take that tube away. Even if you lost a tube, okay, but the remaining tube is perfectly okay, and you are still ovulating from both ovaries, whichever ovary you ovulate from, that okay tube can take the eggs. So if your tube here is gone now, so if your tube, you see the tube, this is the tube, this ovary on this side, this tube on this side, this ovary on this side. Assuming we've taken away your tube, we leave your ovary there. Your tube is still here, your ovary is still here. If you ovulate from here, this leftover tube can pick it up. If you ovulate from this one, you can pick it up. If you've lost a tube, your chances of pregnancy only drops by 30% to 67%. It doesn't drop by half, okay? Doctor, can you please list the basic test again? That's Elom, Kwashi, FSH hormone, LH hormone, D21 progesterone, prolactin, thyroid hormones, testosterone, your pelvic scan, and your husband's sperm count. Good evening, Mercy, Odianosen, Omonabu. Good evening, God bless you. Doctor, please, what's the cause of draw before period? I don't know what you mean by draw. Probably you mean discharge. Naomi Samuel Etem. If you mean discharge or mucus before period, okay, it's just normal. But if your draw, which I think is possibly discharge, is offensive, it's smelly, it could be that you have infection that should be treated, okay? Can someone with high prolactin conceive? Very unlikely. If you got high prolactin, it's unlikely for you to conceive. You can still conceive though, it can happen, but it's unlikely, okay? High prolactin, no ovulation. If no ovulation, unlikely for you to conceive. What can one do if the thyroid hormone is high? If your thyroid hormone is high, we give medications to bring your thyroid hormone down to make it normal. Please, how can a woman with PCOS get pregnant? If you got PCOS, which is polycystic ovarian syndrome, we first of all work on weight loss for you to lose weight. It doesn't matter. Some people say, I'm already leopard now. Well, there's no weight to lose. There's weight to lose. Just by losing 3 to 4 kg alone can make you ovulate. So losing some weight helps a lot. Get a gym. Exercise 3 times a week minimum. 3 times a week, and exercising for at least half an hour at each episode of exercise. And make sure you sweat way during those exercises. If it doesn't work, we can give some medications for heat. And if all fails, then we can do surgery to destroy the cysts on these polycystic cysts on the ovaries. Doctor, does arthritis have anything to... I can't see that question. Doctor, this is Abolore Sharifat. Doctor, what causes the cervix to open early at 23 weeks is cervical incompetence. And if that happens, what we can do is once you get to 12-13 weeks of pregnancy, we put a stitch on your cervix to close and to tighten your cervix, okay? And we scan you every 2 weeks to see if there's any weakness in the cervix, okay? Now, Pamela Anande Kaur is asking, does arthritis have anything to do with fertility? Arthritis has nothing to do with fertility, but some medications we give to treat arthritis might not be compatible in terms of you getting pregnant. So if you're on medications for arthritis, you cannot get pregnant while you're on those medications, because some medications will affect baby that is being formed in the first 12 weeks. Those medications of arthritis will not stop you from getting pregnant, but they could be injurious to pregnancy. So we usually put you on contraceptives while you're on those medications for arthritis. And whenever you want to get pregnant, we take you off those medications so that you can get pregnant easily and there's no problems with your baby. How can you manage hemorrhoids in third trimester? If you got hemorrhoids in your third trimester, what you need to do, because in pregnancy, third trimester, if you got hemorrhoids, it's going to be worse anyway because of the weight of the baby. What you can do is to increase your fiber content in your food, increase your fiber content in your food. Avoid stuff that are so spicy. Yes, avoid spicy food. Lots of water, and then you do your pelvic floor exercises, Kegel exercises, Kegel, Kegel. Type it in your Facebook, type it on your Instagram, type it on your YouTube, type it on our ATG page here, and you see Kegel exercises, everything we've talked about it. Do Kegel exercises, it helps to reduce hemorrhoids at your third trimester. And trust me, and if everything fails, we can also give you some stool softeners to make you comfortable, to reduce constipation. And if you're also in this category, whenever you feel like pooing, don't hold it. By holding your poo for so long, it makes the hemorrhoid worse. It makes the hemorrhoid worse. So Kegel exercises, don't hold your poo, avoid constipation, and use stool softeners. Okay, it helps a lot. Good evening, doctor. This is for Janet Agu. Please, after miscarriage and the womb is cleaned, how can one get pregnant again? By having regular intercourse. By having what? Regular intercourse. Once you've had a DNC, the womb has been cleaned, give yourself about a month to 2, allow your body to heal emotionally, physically, and start having sex with your husband. Regular sex. And when I say regular sex, I mean sex 2 to 3 times a week. Sex 2 2 to 3 times a week, regular sex. You don't have to wait until you're ovulating before you have regular sex. You don't have to wait until you're ovulating to have regular sex. By waiting for ovulation before you have sex, you're only giving yourself 4 out of 10 chances of getting pregnant. By having sex only during your ovulation, you only give yourself 40% chances of getting pregnant. So if you have sex regularly, whether you're ovulating or not, you increase your chances of getting pregnancy more than 40%, close to 80 to 90%. So the only time you're free from sex, as far as I'm concerned, regarding getting pregnant, is during your period. Some people love having sex during their period, though. I have nothing to do with that. But it's a bit messy, though. But it's a bit uncomfortable, though. But you're unlikely to be ovulating during your period, though. But if you want to have sex during your period, that's okay. But for the purposes of getting pregnant, the only time you should avoid sex is during your period. Every other time is a way macho for you and your husband. Bas, boos, bas. Kenny, bas, boos, bas. In quote, you and your husband is for according to the way they speak in Lagos now. Bas, boos, bas. Regularly. Everywhere, up and down, south, east, west, north, south. Everywhere. In fact, don't wear pants. I said again on ATG, it's an abomination for a married woman to wear pants in her husband's bed. You're in your husband's bed, that altar of love, altar of sacrifice of love, don't wear pants to bed. Wear pants to bed in your husband's house. In your husband's house, where your husband is in the bedroom, it's abomination. Don't. Okay, if you wear pants, you move it. Okay, let's continue. From Aba patients, Ochanya. Doctor, is there any complications during intramural fibroid surgery for someone that's never given birth before? Yes, you can have complications. Blood loss, infection, Asherman syndrome. Infections that can damage the tube. Yeah. So, but they are very rare. In skilled hands, they are very rare. If you want to have fibroids removed and don't know where to go, my colleague, Dr. Benjamin, is a guy that removes fibroid 24/7, 7 days a week. If I refer anybody for fibroid surgery, I refer you to him. Elom Kwashi, we have referral links. 2 doctors that I refer people to in Ghana. So if you need them, let me know. Send us an email to our services. Our ATG services email is very, very good. We respond to you. It's ATG Services 2018, ATG Services 2018 at gmail.com. Nelly Ngozi, she's saying, good afternoon, doctor. How are you? I'm fine. How are you too, Ndokwe? My question, I want to have a thorough check of my womb to ascertain if you're good in terms of conception. So it seems, so do you know a place in Lagos I can go for examination? Nike, please answer Ngozi Nelly. She's asking us for the address of the laboratory. So Nelly Ngozi, you can go to ATG Laboratories on Lagos mainland and you can get all your fertility tests done there, including your husband if you got. You can get your scan done, your hormone profile, everything to know whether you're good to go and whether you're perfect. Okay? Somebody's asking, doctor, doctors, I'm 2 days to my 2 something. I don't know what you're saying, Per Johnzo Banjo. Please put your question properly. I don't get your question, please. Put it properly. Good evening, doctor. My prolactin is 38. As patients, Charles Nkwachi, my hormone prolactin is 38. Is it high? I think it's high. Your hormone is high, 38 is high. But it depends on the unit used in the laboratory. If the unit used is what I'm thinking, then it's high. But it depends on the unit because every result has a reference range. But in most cases, 38.8, regardless of unit, is high. Thank you, Nike. I can see your fingerprint there. Nike is our laboratory, ATG laboratory manager. She got customer excellence, superb, par excellence. So if you need your test done, just chat Nike on the lab line. Nike will walk you through every test you need to do. She will even explain to you what you need to do and ensure that you get the best value for your money. So if you need any test done, the manager here, ATG Laboratories manager, is Nike, and she'll walk you through. I got Dr. Adarma Hagadono here as well, and she's watching attentively. I can see you. God bless you, doctor. We hope to see you soon, the ATG, as soon as possible. Have a wonderful weekend as well. Doctor, please, what is the best vitamin if I want to get pregnant? Folic acid. What? Folic acid. It's a very, very important vitamin. It's a vitamin B complex vitamin. Folic acid is under the vitamin B family. Very important in getting pregnancy. Someone is asking a question. That is Edwin Ona Odonwan. Doctor, I was told by my doctor that I'm having polycystic ovarian syndrome, that I should lose weight, but I don't know how to start. And last month, I saw my ovulation mucus, so much pain. Does it mean I'm ovulating? Maybe. If you've been told to lose weight, you can start. Start from where you are. Join a gym. Go to Facebook, where you are in your locality. There'll be other people too that want to lose weight. They'll have a group. Ensure that you are safe though. Join such groups. Exercise, or even watch YouTube videos. Learn how to exercise and exercise. Just by losing 2 to 3 kilograms can change your situation and get you pregnant. But like I said again, for you to get ovulation, you don't have to see mucus. Seeing mucus is not a priority. It's not a condition for you to ovulate. Good afternoon, doctor. That is Ebika Owoso Ukiwa. Good afternoon, doctor. You're in the United States. Do you have a good doctor here in Kentucky that I can see, because I've been trying to get pregnant? I need help. I've been trying for 5 years. First of all, I can't refer you to any doctor in America because the American health system is insurance based. So and I'm UK based, I'm Nigerian based. I have no power to refer you to any doctor in America. So you have to discuss that with your primary healthcare physician in America, and then they will refer you to a doctor under their insurance system. Honestly. Okay, but once you've done all the tests and you want me to look at them as a second opinion to see what needs to be done, what should be done, or second opinion to go through the results with you, for you, I can do that. Ada Grace is asking, Ada Grace Ochola, she's asking, how can she locate our ATG laboratories? Ada Grace, the link we put up to you by Nike, the lab manager now. The lab manager, Nike, wonderful Nike, beautiful Nike, she will put up the link for you to locate the lab now, so that you can come to the lab tomorrow, or at least give Nike a call tomorrow, and she can sort all your stuff out and tell you what to do, how to do it, and she even give you all the directions how to get to the laboratories, ATG and in Lagos. Doctor, how can diastasis be managed? Okay, diastasis can be managed through exercise, proper exercise regime. Okay, that's Tawakalito or Duala. Doctor, you need to take. Ada is saying that she needs to take some tests. Nike, please let me answer Ada. She needs to do some tests. Okay. Princess Oge Best Sparkler is asking, can someone ovulate with FSH of 2.8? Yes, you can. Doctor, I've done all the tests. If you've done all the tests, then send it all to me through the Atg Premium Services. We got you can go to the consult link, consult access, consult services, and I'll go through all your results. For the consult service, for our premium services, everything we teach you is free of charge. Obviously, you know by now it's free of charge. But if you want me to go to your results with you one-on-one, then you have to use the consult services. The ATG Premium Services. We have different categories that can give you access to talking with our doctors here at ATG. There's the Platinum Service, which is a year. That service contains access to me to discuss your results to me, and even do a video conversation call consultation like this. Number 2, we got a Diamond Service, which is 20,000 naira as well for a full year. For that Diamond Service, you can call me on the WhatsApp line I'll give to you to go through your results. Number 3 is the Gold Service. It's also for a year. For Gold Service, no calls, no video calls, only text and voice notes to go through your results, but it's also for a year. The Platinum, the Gold, the Diamond, you have access to all our ATG seminars and all our PDFs that we've written for educational purposes for women like yourself. We also have the Consult Service for people who can afford the Diamond, the Gold, the Platinum. There's a Consult Service which is only for a month, 4 or 5. That one, you can text me your result. I go through them and reply back to you and give a second opinion for only a month. If you think a month is too long for you, you want to use something shorter, we have the weekly service. The ATG Weekly Consult Service, which is only 2,700 now. I go through your results, everything, and that's it. So those are for you. Someone's Chinwe Teresa is asking, can weight loss help in reducing fibroids? Yes, it can. You know, statistically, people that have fibroids, they are slightly on the obese side of things. Doctor, you're having kidney stones. That will it affect getting pregnant? No. But you gotta remove the kidney stones. That's for OG Obaose Rita. Good evening, doctor. You're having Hello, doctor. I just had my IVF done I'm 10 days gone, my embryo will transfer, but I'm hearing my noise in my tummy. Noise in your tummy after transfer has got nothing to do with implantation. 10 days, in the next 4 days from now, go and do a test of pregnancy. Guys, I gotta go now. My throat is dry. I hope to see you later today to talk with you more and to have more chat with you. Thank you so much for being here. Don't forget to, this month, I'm going to take time to go through ovulation. Why your ovulation is not regular, why your period is not regular, how you can make your ovulation regular, how you can make your period regular, how to spot cervical mucus, and when cervical mucus happens, and actually what it looks like. These things I'll be discussing on the ovulation seminar coming this month, March. If you've not registered for the March seminar, this is the time to avail yourself of that opportunity. Get registered now, and I hope to see you there. God bless you, and so much love to you. My name once again is Dr. Alalade Babajide, one of your admins here at Ask the Gynaecologist. See you soon. God bless. Bye-bye.